Concerned a shortage of albuterol could get worse. It comes after Acorn, one of only 2 drug manufacturers that makes liquid albuterol, recently closed its plant in Illinois. Albuterol is used in inhalers to treat asthma, and according to a recent study, it's in the top 10 most commonly prescribed medications in the U.S. And joining me now is Dr. David Beuther, a pulmonologist and Chief Medical Information Officer at National Jewish Health. Dr. Beuther, thank you so much for coming today and talking about this very important issue. You actually brought some props with you, so that's good. Having 3 kids, I know these props very well. Tell us more about albuterol and the conditions that it treats.
Yeah, sure. Albuterol is used really to relax the muscles in the airway, and so it helps to open up airways that are narrowed from conditions like asthma and chronic obstructive pulmonary disease, or COPD. And it's really a short-acting medicine that's often used kind of almost as a rescue treatment when you're in a crisis. And that's what's really important about this story, is that it is the main medicine used to get you out of a jam if you're having trouble breathing with one of those conditions.
So obviously very concerning that the FDA on the shortage list, it's been on that list since the fall. What is that plant shutting down? What does that mean for lung patients in the coming months?
Well, I think first a lot of anxiety, right? But there's a lot that we can do to help reduce that anxiety, I think. If you're a patient at home, a lot of times your main medications are long-acting medications. If you're an asthmatic, there are medicines you take every day so that you don't need to take the albuterol. And if you have other conditions, there are longer-acting bronchodilators that we can use. So if you're using the nebulized albuterol at home, what you need to do is really contact your doctor. We can help. That's what we're here for, is to help find alternatives. The issue in the hospital is a little different. This really only affects liquid albuterol. So that's the type that you use in your nebulizer device at home. It does not affect the inhaled albuterol, and that's really important. So a good quality albuterol inhaler used properly is just as good as a nebulized medication. And if we get people on the right medications, most of those at home will be okay.
So there are some alternatives, which is good to hear. How are hospitals and medical centers, how are they responding to this shortage?
Well, this has been kind of a cascade of events, and with the bankruptcy of this one company, it's gotten recently worse, to amount to about a 40% reduction in the amount of albuterol that's available. In most hospitals, they might have about a 2-month inventory backed up, and that may be down to about 3, 4, 5 weeks right now. In hospitals, oftentimes we use more of this kind of nebulized albuterol, which is the one that's so affected by this, particularly for sick patients or for very, very young or very old patients. And we're having to switch to different types. There are actually different types of this medication that we can use. So hospitals are ordering more of that type of medicine. There are some different formulations, and people are remixing things. And so right now it's not a crisis, but it's something that hospitals are actively planning so that we're prepared.
That is good. What is your overall message to anyone who might be concerned about this?
I think what would really help is if you're using the liquid albuterol in your nebulizer at home on any regular basis, to check to make sure that you have enough supply, and really talk to us, talk to your healthcare provider. We can help. Oftentimes we can adjust your medications or provide you with alternatives so you aren't as dependent on the medicine that sometimes is going to be pretty hard to get until it becomes more available, hopefully later this year.
This is all good information, Dr. Beuther. Thank you so much for joining us today.
Thanks so much for having me.
All right, and remember, you can watch all of our health interviews right now on CBSColorado.com. Well, First Alert meteorologist